Hi everyone. Today we are going to discuss about HbA1c, that is glycosylated hemoglobin, which is very useful in assessing the patient's blood glucose concentration over the past 3 months. So in normal adults, hemoglobin A is there, which contains 2 alpha and 2 beta globin chains, and this comprises of about 95% of total adult hemoglobin. Coming to HbA2 is also present. Here alpha 2 and delta 2 globin chains are there. And this HbA2 comprises of about 1.5 to 3.7% of total adult hemoglobin. Fetal hemoglobin, that is alpha 2 and gamma 2, is also there in adults. This is less than 2% of total adult hemoglobin. So coming to the major subtype of hemoglobin, that is HbA, it contains alpha 2, beta 2. This is the diagram. So these are two alpha chains and these are two beta chains. So in beta chains, there is a N terminus, which is very important in discussing about these subtypes of HbA. So some compound will get attached to N terminus and HbA1 form. So HbA1 is a minor component of normal adult hemoglobin that has been modified post-translationally. That means a component has been added to the N-terminus of beta chain. So this HbA1 is also called as fast hemoglobin or glycated hemoglobin. So HbA1 again has three subtypes that are HbA1a, HbA1b, and HbA1c. Based on the compound that attached to N-terminus of beta globin chain, these subtypes can be described. So in HbA1a, the compound attached to N-terminus of beta chain is fructose 1,6 diphosphate. In HbA1b, some books say it is pyruvic acid that gets attached to N-terminus, but some say some unknown corps will get attached to N-terminus. Coming to the most important one, that is our favorite HbA1c. Here glucose will be attached to N-terminus of beta chain. So among these three subtypes, HbA1c has most important clinical significance. So normal RBC lifespan will be 100 to 120 days. The amount of HbA1c depends on a time averaged concentration of glucose with older cells having more than younger cells. So the RBCs must be exposed over a prolonged period of time so that some post-translational modifications can occur in the beta chain and HbA1c forms. So here, younger RBC will not have much exposure. Older RBC will have prolonged exposure. That's why younger RBC will have less HbA1c. Older RBC will have more HbA1c. But here, in younger RBC also, if the blood glucose concentration is very high and younger RBC exposed to the very high blood glucose levels, in them also the level of HbA1c rises. So the patient will have more HbA1c. So this is the best indicator for the assessment of blood sugar levels in the last 3 months. Here some specific cases like hemolytic anemia in which RBCs are getting destroyed at a faster rate. So they are replaced by new RBC by bone marrow. So as new RBCs are not exposed to glucose that much, these new cells will have lesser HbA1c. So falsely low HbA1c levels will be there. Similarly, in sickle cell anemia also, there will be both HbS and HbA, but hemoglobin A will be in less quantity. So there is also falsely lower HbA1c level can be seen. And also in patients who are receiving erythropoietin injections or supplements, they have increased RBC productions. There also similarly a new RBC erythrocytes will be there. That's why there also false HbA1c levels will be seen. So we cannot rely on this HbA1c to diagnose diabetes or to assess the last 3 months blood sugar average in these patients.